Have you ever stopped to think about the word radius? You know, it's a word you hear in math class, but then it pops up again when you're talking about anatomy. It's kind of weird, right? Well, today we're going to connect those two worlds and figure out how a simple circle actually explains a really important bone in your arm.
So, on the one hand, you've got the geometric radius. Super straightforward. It's just a line that goes from the center of a circle to its edge. We all remember that. But then you have the radius bone, which is right here in your forearm, on the same side as your thumb. So what's the deal? How can they be the same thing?
And that really brings us to the big question for today's explainer. What in the world does a part of a circle, like a spoke on a wheel, have to do with a bone in your forearm? It seems totally random, but I promise you, there's a really cool reason they share a name, and by the end of this, it's all gonna click.
So here's our game plan. First, we're actually going to find your radius bone on your own arm. Then we'll take a quick tour of it, see how it moves, talk about why it's so important, especially in medicine, and then we'll wrap up with a quick review. Sound good?
Okay, let's jump right into part 1, finding your radius bone. Before we get into the details, let's just figure out where this thing is and what its basic job is.
So in your forearm, you've actually got two long bones sitting side by side. The radius is one of them. The key thing to remember is that it runs parallel to the other bone, the ulna, and it's always on the thumb side of your arm. It stretches all the way from your elbow down to your wrist.
All right, time to make this real. Do you think you can find the radius on your own arm right now? Let's try.
Go ahead, take your other hand and just rest it on your forearm. Make sure your thumb is pointing up toward the ceiling. Now, if you feel along that thumb side, that solid bone you feel under the skin, yep, that's it. That's your radius.
Pretty cool, huh?
Excellent. Now that we know where to find it, let's move on and take a closer look at its structure. Think of this next part as a little top-to-bottom tour of the radius bone. To keep things simple, we can break the radius into three main regions. You've got the proximal end, which is the part up near your elbow. Then there's the shaft, which is just the long middle section. And finally, the distal end, which is the part down by your wrist.
Okay, let's start our tour right at the top, at the proximal end. This is where the radius meets up with the other bones in your elbow joint. Now, before I just tell you, I want you to look closely at the shape here. The very top of it is like a flat, round disc, almost like a coin. Why do you think it would be shaped like that? What kind of movement does a shape like that make you think of?
Well, if you were thinking rotation or spinning, you are spot on. This disc-shaped part is called the radial head, and its shape is absolutely perfect for one thing, allowing your forearm to rotate. It fits right in with your upper arm bone and the ulna and just pivots. That simple shape is the entire secret to how you can turn your hand over.
All right, let's travel all the way down to the other end of the bone, the distal end, where it connects to your wrist. And you can see right away, it looks totally different down here. It's much, much wider. See that pointy part on the side? That's called the styloid process. And you can feel this one too. Find the base of your thumb on your wrist and feel for that hard, bony point. That's it. It's a super important spot because it acts as an anchor for the ligaments that keep your wrist strong and stable. So now we know where the radius is, and we've seen its parts. Let's get to the really cool stuff. How does it all work together? This is where we finally answer our big question about how the bone got its name. And here it is, the big reveal. The bone is called the radius because it literally acts like the radius of a circle. It spins around the ulna, which stays put and acts like the center point. It's incredible, right? The name isn't a coincidence at all. It's a perfect description of what the bone does. This image shows that movement perfectly. The radius bone is the one doing the moving, pivoting over the ulna, which is pretty much stationary. This is what allows you to turn your palm up, which is called supination, or turn your palm down, which is called pronation. Let's try it one more time. Put your hand on your forearm again, and just slowly rotate your other hand, palm up, then palm down. Can you feel that? That shifting under your fingers? That's your radius bone, making that incredible move. It's not your shoulder or your elbow doing the twisting. It's this amazing design right in your forearm.
Okay, so this is all really fascinating from an anatomy perspective, but why is it so important to know about this one bone? Well, let's switch gears and look at this from a more clinical point of view.
I want you to think about something we've all seen or heard about. Someone trips and falls, and they put their hand out to catch themselves. Why does that so often lead to what everyone calls a broken wrist?
What did we just learn about the end of the radius down there? Well, it's because that wide distal end of the radius is what takes almost all of the force from the impact. And because of that, it's actually one of the most frequently broken bones in the entire body. So when someone says they broke their wrist, a huge percentage of the time, what they really mean is they fractured the distal end of their radius.
All right, we have covered a lot. Before we finish up, let's do a super quick review just to lock in the most important ideas.
So if you remember anything from this, remember these 3 things. 1. The radius is the bone on the thumb side of your forearm. 2. Its most important parts are that round, disc-shaped head at the elbow for spinning and that wide, pointy process at the wrist for support. And number 3, its main job is to rotate around the ulna so you can turn your hand over. And that's really what I want to leave you with. We just unpacked the complex anatomy behind a movement as simple as turning your hand. It kind of makes you wonder, doesn't it? What other simple things that we do every day without a second thought are being powered by an equally beautiful and complex system just waiting to be discovered?